Hi there, Mark Jaben, Medical Director of the Haywood County Health Department, and let's talk about this pandemic. Still in my hermetically sealed production studio. So today, let's talk about a symptom that we are seeing more and more of. The most common symptoms of COVID have been fever, cough, aches, fatigue, shortness of breath. Often it starts with one or two symptoms, such as congestion, runny nose, or sore throat, and then progresses over a few days. Loss of taste or smell have sometimes come before the onset of cough, and GI symptoms like nausea, vomiting, or diarrhea can precede fever and cough as well. And much of this remains the same now. And any of these should cause you to pause and consider whether this could be COVID starting up. Because it's tough because these symptoms could go with so many different things. But if you think about it, get tested, especially if you have been in a high-risk environment over the previous few days. Indoors, crowded, loud, no masks. Although with the governor's recent order, the risk factor about no masks should be markedly reduced if not eliminated. Call your doctor, or if you don't have one, go to an urgent care. Either way, call before you go so they can be prepared to collect your specimens safely. Now, although headache is well documented with COVID, recently we have seen more and more people have a headache as their initial symptom. And this makes sense if you think of COVID as basically an inflammatory disease. Any organ, anywhere in the body can be affected. For instance, inflammation of the lungs leads to pneumonia. Perhaps it's inflammation of nerves that account for the loss of taste and smell. And even the brain can experience inflammation that causes a headache, young and old alike. We've seen quite a few cases that began this way. The person doesn't think of COVID necessarily, and so continues going out about and exposing others. It's not their fault because this has not been talked about very much, but it does mean more people exposed, more contact tracing becoming more complex, and contact tracing is really the key right now to control the viral spread. And this becomes really challenging if the person has a history of headache. How can you tell? Well, there are some clues. With COVID, the headache is most often described as vague, nondescript, or dull, and not particularly severe. A headache that starts all of a sudden and becomes really severe within minutes is probably something else. If the headache is accompanied by confusion or weakness, that might be COVID, but it might not. Either way, immediate evaluation would be in order. And don't forget, this is summertime. There are tick-borne illnesses around western North Carolina. Headache, fever, sometimes rash are typical symptoms of that, so don't forget that. So the best way to think of this is, if you have headaches, the COVID-related headache will be different from what you usually experience. So when should you really worry that maybe the COVID symptoms you have are something more than a mild illness? Well, if you have fever and cough and then develop shortness of breath, you should know the median time from onset of symptoms to acute respiratory distress is around 8 to 12 days after symptoms start. So if you have COVID and get an increase all of a sudden in shortness of breath after a week or so, a red flag should go up. Be concerned because this is where people have really had trouble. People have also developed sudden deterioration a week or so after onset of symptoms with heart attacks, blood clots, and strokes, even young people, all related to inflammation of blood vessels. And incidentally, you might be interested to know the median length of hospitalization for survivors, if they need to be hospitalized, is somewhere between 10 and 13 days. Much about COVID has not changed since it first arrived, but some things have. So follow the 3 W's, show an IQ, isolate if positive, and quarantine if exposed or awaiting tests, and practice the golden rule of gathering. So be well and be careful, especially right now.